Welcome back to another episode of the Resting Stitch Face podcast. I'm your host, Dr. Erin Sheffield with
Dr. Sarah Harding.
Hi, Sarah. Good morning.
Good morning or afternoon for you, I guess.
Yeah, it is afternoon. Well, I have been going through my old drafts in TikTok. I have so many old videos that I've made that just I never felt like were worth posting or whatever. And so I was going back through and I found one that was talking about this new article, which was like 2023. So that's how old this video was that I made. New article that just come out with a couple of other articles, if you remember, talking about how women surgeons may actually have better outcomes than male surgeons. Some of those we're looking at like short-term and long-term outcomes. So outcomes at 90 days versus outcomes at a year, and showing that the morbidity and the mortality was actually less for patients of women surgeons than male surgeons. I think there was another article that talked about how maybe some lower complication rates and even lower healthcare costs. Do you remember those?
I do. Yeah. I remember them being posted and reposted and reposted.
What was your feeling seeing that? Did you have like a gut reaction?
Yes.
I thought so. That's why I asked.
Shocking. My first reaction was, well, yeah, that makes sense. And then I got to thinking about why. Why, Sarah? Why does that make sense? And I don't know if it's the way that I think about it, because I'm always self-deprecating, sadly, is that I spend a lot of time with my patients preoperatively, managing expectations, talking about what's going to happen, talking about diet ahead of time, talking about diet afterwards, talking about all of the things. This is what you'll probably feel. Everybody's a little bit different. And so I think that I always say that the hardest part of our job is patient management. But one of the things that makes it a little easier is expectation management, right?
Yeah.
And so I think that outcomes, and tell me if I'm totally off base with this, but I really truly feel that outcomes are subjective. They are objective, but they can also be subjective, because if a patient, swelling and pain on day 2, 3, 4, and I've already told them that those are going to be your hard days, do they see that as a bad outcome? No, they saw that as an expected postoperative concern. And so that's kind of the way that I looked at it.
That makes a lot of sense. And I think that's one of the proposed reasons that they've said that women might have better outcomes, is because they tend to spend a little bit more time with the patients, or to be a little more collaborative, or explain things. Listening is a big part that they propose as some of the reasons that the outcomes might be better. So it may not have as much to do with surgery as definitely the management side that you mentioned.
Yeah.
I remember when those came out, I'm trying to think, like, was I surprised to see that? I don't think I was surprised either. To me, it was kind
I was
of
actually
like,
only surprised that
yeah.
it was published. That was it.
Sure.
I wasn't surprised by the actual, like, what they were saying.
Sure.
I was surprised.
Sure.
I was surprised that it was published at all, because
Yeah.
I don't feel like things like that generally get published.
Yeah, definitely.
But I think that's all to say that I don't think that we're doing any better of surgery, right? I think that, just as well as I do, when you have a patient that's like super anxious and super worried that they're going to get this or that, or they're going to have this complication or that complication or this or whatever it is, they tend to not do as well, right? And so if you can reassure them, if you can answer their questions ahead of time, if you can listen to them, if they feel listened to, if they feel as though they have a help button that they can push, then I think that tends to make their recovery better, and hospital stays shorter, and return to normal function sooner, and all of those things and so I don't think that the surgery in and of itself is any different. The closure is no different. The plating is no different. All of that stuff is no different. It's just the perioperative period and expectation management is different.
That makes so much sense. I don't think I quite thought of it in that way before. Probably not that much difference surgical skill-wise from many surgeons. I would suspect most surgeons were performing on an average level. You might have some that maybe are a little subpar, and some that are just supremely above everyone else.
Yeah.
But I think some of it probably is even maybe like your willingness to take someone back to the OR if there was an issue, or to listen enough to identify a problem early enough on that. Because think about a festering infection. If you catch it early, it's so much easier to get under control than if you let it lead to sepsis or whatever else. So I could see that kind of thing leading to better outcomes. That makes a lot of sense. I was really happy to see those published, and to me, it was just really validating because I think there's been so much narrative around women in medicine, women in surgery, and this idea that we don't deserve to be here. And even in our oral surgery literature, and I wish I had it in front of me now, I should have been more prepared for this episode, but I remember preparing a lecture talking about women in our specialty and how far we've come and how far we still have to go. One of those articles, they interviewed male oral surgeons, and they were trying to flesh out different attitudes towards women based on like older private practice doctors and residents. And I thought it was surprising that the older gentlemen seemed to have more favorable feelings towards us and our
Mhm.
abilities than the residents. I'm hoping that means because after some experience and working with us, they've figured out like, oh yeah, they do great. They're about the same. But the residents overwhelmingly
Yeah, I've got it pulled
had
up. Let
some
me see.
really negative or ideas about women, that women aren't emotionally strong enough to do the job was a really big one. And that's really hard to hear, especially when you're with your colleagues. And for me, I'm thinking, did the residents I worked with think that stuff about me? I would have thought, oh yeah, the old chauvinistic guys would think that. But are the young guys that I was working with thinking that kind of stuff about me? And certainly some people weren't supportive and some patients aren't supportive, and just the framework of medicine or maybe the specialty doesn't always seem as supportive of women as I would like. It's kind of hard to see that. And so when I saw this article, it was finally like, yes, validation.
Yeah.
See, there's like numbers, there's data to show we deserve to be here.
Oh, that's funny. I just pulled up the article and it was, I think this is the one, Male Perception of Women in Oral and Maxillofacial
Yeah,
Surgery.
I think that.
Then Joms in 2014. Wow. And that was Farzaneh that did that. She was at VCU with Dr. Laskin. She was an intern when I went and externed at VCU. I love that. She's
Cool.
super cool. But yeah, I think it's really interesting. And it was interesting too, just to be in the room as a resident doing interviews and having the one resident be like, we interviewed this gal that was the top of her class and she wanted to do like pediatric craniofacial surgery. And they're like, well, she's probably just going to want to have kids. And so there's no reason to have her here. And I was like,
Yeah.
what? Give me a break. Even if she wants to have kids. So it was this big thing. But then that thought was persisted, like having that attending that came in, and it was right around the same time of residency interviews. And he was like, Sarah, can you do the second thing that you're good at? I know the first thing is like wedding planning or whatever, but can you clean up the resident room? It's kind of a mess in here. And I was like, you know what I mean? And it's just like, so that same mindset was propagated, and then it was okay, right? Because then it gave other residents permission, I guess,
Mhm.
to act that way, to say those things.
Mhm.
But it was a young attending, and
That's terrible.
it's just frustrating.
Some of the studies have shown that women dental students are intimidated or dissuaded
Mhm.
from oral surgery because they see these kind of comments and relationships
Behavior.
and these
Yeah.
behaviors, and so they choose not to go into our specialty. And so if we're recruiting or pretending to be recruiting women, these kind of things are not helping us to close that gender gap.
Yeah. So then what was some of the feedback that you got when you posted this? I was really excited to see that these things came out, right? And it's
Yeah.
nice to start a dialogue and have a conversation, because it seems like, oh good, now we can have a conversation about this.
Yeah.
But what kind of feedback did you get?
Well, I thought it was interesting. Basically, I'm saying, did you know women surgeons might have better outcomes? And then I just quoted the study, like both short term and long term, and that some healthcare costs might be lower. And so I said, they've been saying for a long time that we don't belong, and this shows that we do. And that's it. And then I showed the article. And so it's interesting because you get comments that are like, I love this one. I don't care about anything like that. Just get me fixed. Or I don't care if you're a man, woman, black, Scandinavian, or gay. If I'm injured, I just want to be fixed. I'm paying for what I hope is a positive outcome, paying for the results. And some people are like, oh, that's so interesting. And then a lot of people wanted to discount it by saying, well, yeah, there's so many more male surgeons, so of course they'll have more complications than women. And I think people making studies run stats and can
Yeah, for
account
that.
for stuff
Yes.
like that. So I don't know. I'm getting a lot of arguments about that,
And
but
actually that is a very unvalid argument, because there's so many more. You know what I'm trying to say? That like when you have 5 people and one person makes a mistake, that's a 20% mistake rate.
yeah,
Whereas if you have
sure.
500 people and 50 people make a mistake, then it's
Sure,
only
yeah.
10%,
No, that makes
so
sense. Yeah, interesting you left out that female surgeons only treated 23% of the patients, while the male surgeons treated over 75. So of course he will have more complications as he is treating way more patients. Very deceptive article. So you get
yeah.
people like that, which I think some of that just shows people don't understand studies and stats and all of that. Then, of course, you get people telling their personal anecdotes about how a woman surgeon didn't do a good job for them or whatever. But I'm trying to find, there was an anonymous one. Every top oral maxillofacial surgeon is male. Every top double jaw surgeon is male. Which, thanks, Anonymous. That was really brave of you to say. But now I'm trying to find the one that got to me. Of course, I'm not seeing it in this moment. I wonder if they took it down because I kind of came back at them hard. Someone was saying that this was a disgusting post that I made. And I thought that
Yes.
was really interesting because they were just saying it was disgusting and how they are the best doctor in their clinic and they're a man. And I thought that was so interesting. I didn't make any kind of judgment calls. I didn't make any kind of commentary besides, yeah, it looks like we deserve to be here. And yet it was disgusting to him that I pointed out this is what the data showed. There are so many things in our society that we are used to happening to women that we just accept as normal. And when you flip the script and put it back on men, suddenly it's so egregious and so unacceptable. And this was an example to me. So isn't it disgusting that for decades you've been telling us that we don't deserve to be here? And now this slight percent, I feel like maybe it's only like a percentage point difference. So does that even matter? Probably not. To me, it wasn't about being like, yeah, we're the best. Women are the best. It was more
Right.
just like, see, we all deserve to be here.
Yeah. Yeah,
And
that 1
yet
percentage
taking
point
offense.
difference, yeah, is very different than the percentage point difference in pay and
Yes.
opportunity and
Right.
speaking engagements and ability to be on boards and all of the things that, like, if we're coming at it from an even playing field, but it's clearly not compensated as such. I think that's really the point that this whole thing is making. It's not that women surgeons are better than men surgeons or that sort of thing, but it's just like, okay, if this is an even playing field and we're all like, I was on call just like you were on call. It's not like I just treat people in this hospital and they're all healthy people and you only treat sick people. That's not how it works. It's all
Right.
shared. The real stark contrast is in compensation and in opportunity.
Yes. As I was researching again for that talk that I gave, that there was a point that every single specialty, there was a pay gap across the board, even in OB, which is female dominated. Even on their boards, it's mostly men on their board and in leadership.
So, yeah.
Even though they're like, I think they're 50, 60% of OBs are women. And yet they're still underrepresented in their leadership and they still have a pay gap. And our pay gap was the worst than any that was published. I think ours is like 40%.
Oh, wow.
So that's discouraging. And people like to make comments all the time like, well, that's because you don't work as much and blah, blah, blah. But people don't realize these studies, again, are accounting for these things. So I think that's a big oversimplification. And it's just a way for people to
Dismiss them.
dismiss it and not have to face the reality of that. There is a lot of emotional labor that women end up doing, or even physical labor, like cleaning the lounge or whatever. And even, I don't know if you've seen this, but some of the commentary is that as a woman, we often have to build a lot more social collateral to do that. We might have to bring Dunkin' Donuts on our way to the hospital for rounding, and we might have to spend an extra 5 minutes shooting the breeze that a man wouldn't have to do before we can ask for a dressing change or
Yeah. And a lot of
any
the
of
recent
that.
literature too has been talking about how a female physician receives a significantly higher number of EHR messages and stuff from patients than their male counterparts do. And you have to reply to those things within a timely manner.
Sure.
And a lot of hospitals are cutting back on the support staff. And so you'll have a team where you'll have a PA or somebody that can respond to the messages and filter through them. A lot of times they're cutting back on these things. And so that goes right back onto the physician and more paperwork that needs to happen. And if women are responding to 20% more messages a week, that's still time and it's probably their own time, Or if they're doing it at work, then it's cutting back on the amount of patients they can see or the amount of time they're able to spend with each patient. And so
I see also too women I think women are more likely to take on some of these tasks like social media things, marketing type things for a group. I met a woman in DC and she was talking about how she's part of this very big healthcare organization, one of those names that anyone would recognize even across the country, and how she runs this very successful podcast for them that has like millions of views on it, and yet she doesn't get anything for doing that. Like,
yeah,
and we're like, "No, you need to negotiate,
yeah,
more. They should be paying they're probably monetizing millions of views. You should be
mhm,
getting a piece of that pie." She's doing it because she's wants to help educate people and be a team player and all of that. Do you think some of it has to do with our socialization as women, that we're helpers and we're nurturers, and
I mean, for sure.
what do you think?
I think that that's fine. Like, that's okay, right? I think that there's a place for men and women, and we bring different strengths to the table,
Yeah.
and we all can offer something. And you know what? We can be very good at those things, and there's men that can be very
Mhm.
good at those things. But typically, it's very interesting because I think that the real problem when it comes down to is asking for it,
Sure.
right? Because there's not anybody that's going to give you something if you don't ask for it in the
Yeah.
business realm, right? And
Yeah.
that's what my husband keeps telling me that.
Well, and I think it is harder for women to ask.
Hmm.
That's, I think, a big part of it. Maybe we're shooting ourselves in the foot by not asking. I think
Hmm.
also asking isn't received as well, maybe sometimes from a woman as a
Right.
man. And that makes it a little tricky. I think sticking up for ourselves is something that a lot of us didn't learn to do. It was always to be uber
Yeah.
tactful and to not, make
Demure.
waves and yeah, very demure, very mindful.
But I don't
It's
know, and it's
about
also like, if you have ever been through surgical residency, the bravado that comes from our male counterparts, is a lot of time, what we do is crazy, right? Like the surgeries and stuff that we do are big, and I sometimes wish that I could have that sort of bravado, but I
I
don't,
know, I know.
and so you would think that their outcomes are significantly better based on the amount of worth that they tell you that they have.
Yeah, I always thought I was the dumb one
Yeah.
because everyone was just like, "I'm the man, and look how good I," and they're so confident, and I'd come home and my hair would be a mess from my scrub cap, or there were dishes in the sink, and I would just feel like, "I'm the worst."
Yeah.
And I'm like, "I wish that I could be like, 'I cured cancer today. Woo!' I'm the
Yeah.
woman." But that's not how I felt. I put my worth on so many other things and some dumb things like the
Yeah.
cleanliness of the house or definitely my appearance, and
Yeah.
none of that
It's so funny. I
matters.
remember thinking in residency, like, how much more successful I would be if I had a wife. Like, they're like, "Oh, well, what do you do in your free time?" Like, I mean, I don't understand. Like, and I was like, "Oh, well, I have to do my own grocery shopping. I have to clean my own house. I have to do all of the things myself that somebody else does for you. I have to make my own dinner. I have to make my own coffee." All of
Birth
the
your own
things.
babies.
And all of that stuff takes a lot of time. And
Yeah, it
so
sure does.
it was just interesting. I remember saying that out loud, like, I just need a wife. But
Uh,
I mean, and I hate to say that, but it's true. It's so interesting.
oh,
So,
yeah, for sure. One important point too is it's not about bashing men, going back to that disgusting comment, or someone
yeah,
said something like, "You're an advocate for women," and then you post something harassing and discriminatory like this. And that is not the point of the video.
yeah,
Again, I was just sharing the data that came
yeah,
out and making the point that we deserve to be here just like anyone else. And
yeah,
as much as people have been saying we don't, for whatever reason, we're not strong enough emotionally or physically, or can't hack the hours or any of that, and that's not panning out. But it's not about bashing men. And when we did the lecture at our association meeting talking about the challenges of being a woman, we had some really bad reviews from a woman in particular who was really offended and was like, "I can't believe you're just coming on here and being man haters and bashing men." And I was hoping to come to this lecture and see like how far we've come and the amazing things that we've done. And instead we're just whining and playing the victim. And I'm like, that's not really what it's about at all. In my mind, we have to see the problem before we can fix the problem. And
hmm,
we love to think like, "Oh, that used to happen," or "that doesn't happen to us," or "it doesn't happen anymore." But I have lists of 30 egregious harassing, horrible, discriminatory things that have happened to women practicing now, some of
Mm.
them happening probably yesterday. And we're not sharing that to necessarily even point the finger, but just to show these things are happening
It's
and it's
ongoing.
real.
Yeah.
And if we don't address it and try to stop it, I think it's going to continue on. And
Yeah.
so showing people who in their mind really think we don't deserve to be here, that the studies, the data, they're science people, maybe that helps break one more barrier.
Yeah. Yeah. And I think too, like I said before, I think we all have a place here.
Oh, yeah.
And again, competition is the enemy of community, right? And that's my biggest mantra that I've had in the last year is we're not competing. We're here to take care of patients
Yeah.
and we are here to support each other and build each other up. And it doesn't have to be polarizing, right? In that article, I don't think necessarily was polarizing. It just goes to show that this is what we found and we're all good at something. Some patients require a little bit more nurturing. And if you're good at that, then you'll probably do well with those patients.
Sure.
Some people don't, and that's okay too. And so I just think we all have a place here.
Yeah. We want a place. We just want a place. Just want to be in the club.
Yeah.
I
Yep.
agree.
Well, I like it. And I'm glad that article was published and that it brought to light a lot of the other articles that have and the research that's been done that maybe didn't get the press that one did. But it
Mm-hmm.
just goes to show that I do think things are improving, but there's still a long way to go, as always.
Yes, definitely.
But I think it's important to always ask for your seat at the table as well. And that's something that I think needs to be talked about more and encouraged more than it is for
Yeah,
everybody, really. But I think
I agree.
especially us. So these get
Yeah, we
praise.
did. We just you build your own if you
Yeah.
aren't invited. Well,
Pretty
I'm
good at building
excited.
tables.
I've been friends online with Dr. Argivon Salas on TikTok, and she is one of the researchers that has come out with many of these studies, and she's agreed to be a guest on the podcast coming up soon. So we'll be able to have some more interesting conversations like this with her. I'm really excited to find out her perspective as well.
Yeah.
Something to look forward to.
Yay. Thanks, Erin.
Thanks for joining us. Catch you later.
See you soon.
Thanks for listening to another episode of The Resting Stitch Face. If today's conversation spoke to you, imagine what it would feel like to connect in person. That's exactly why we created The Doctor Is All In, a retreat just for women in oral surgery. Learn more and grab your spot at thedoctorisallin.org. We'll see you next time.